Hello and welcome. My name is State Representative Tommy Vitolo, and I'm recording on Brookline Interactive Group. And we're here today with Natalia Linos, candidate for Congress in the Massachusetts 4 District. That's the seat currently held by Congressman Joe Kennedy. And we're going to get right to it. I want to get to know you, Natalia, and understand why you're running and what you're thinking. So thank you for being here. Maybe you could begin by just giving us a couple of minutes about what your life was like between, say, birth and the beginning of 2019. Where are you coming from?
Thanks so much, Tommy, for having me tonight. I really appreciate it. So I was born in Cleveland, Ohio, but were medical students that did their residency in the US, but they were Greek, and they moved back to Greece when I was just a month old. My mom is an epidemiologist also, like myself, and became an assistant professor at the Medical School of Athens. So I spent my childhood in Athens, in Greece, growing up in a big family. I'm the third child of 5. We're 4 girls and a baby boy. And I came to Massachusetts at 17 when I came to Harvard College to study. So in many ways, my life is a life of an immigrant. I moved to the US alone. My parents still live in Greece, although all my siblings are also in the US right now. And I had a long career at the United Nations. I started off first in Beirut, Lebanon, and then spent several years at the UN in New York. And right now I'm in Brookline because I'm the executive director of the FXB Center for Health and Human Rights at Harvard. I have lived in Brookline multiple times because I have 3 degrees from Harvard. My master's and my doctorate degree were also at the Harvard School of Public Health. So it's wonderful to join you, and I hope to share more about my campaign today.
You bet. And many viewers may know, some may not, that you were, without question, the last candidate to get in. As we remember, in March, it was awfully tough for candidates to get signatures, and then the SJC ruled that, hey, ballot access is important, and that means welcome to the 21st century. Thought, it was great to have that ruling. And maybe that was the window, but how is it that you decided to run, certainly at the last minute?
So Tommy, I've been in politics in a broad sense, in policymaking for a very long time. Both at the United Nations, I was in front offices sitting in meetings with heads of states and ministers, but I also worked at the New York City Health Department, leading a lot of work on mental health and during Ebola. But really what led me to run for office, so it has been in the back of my mind that politics and running for elected office is one way to make immediate change. But the reason was COVID. Unlike others in the race, I was not going to run for Joe Kennedy's seat, especially when there were so many people running. But I'm an epidemiologist. I'm a social epidemiologist who has spent 10 years working in an international organization. So at a time of a global pandemic, it felt that this expertise of both being a public health expert and having international experience was unique. I don't think that I would have run. I have 3-year-old twins as well as a 7-year-old, unless it felt really urgent, unless it felt that I had a skill set that was unique, and unless it felt that Congress as a whole, the people who are going to be deciding on how we roll out a vaccine, eventually we'll have it, how we reopen, if they had that expertise, I would be sitting on the sides. But they don't. There are only 11 scientists in Congress, and it feels that that skill set is necessary. So I jumped in, and it was very, very late, as you say.
And so you've got some ground to make up, certainly, for the election. But I want to focus on COVID a little bit. You said it, thinking about this global pandemic and your rather unique or specific set of expertise and experiences really dovetail well with this. But surely if you felt that the nation was handling this pandemic rather elegantly, you wouldn't have felt that calling. So can you tell us, maybe, were there some things going on in February and March and into April where you said, somebody's got it totally backwards. This is a big deal. It's time for me to step up. What were the things that you weren't happy with or feeling like weren't going the way you felt they should have been with respect to COVID?
So Tommy, it started early, my worries. My worries started in, late February when President Trump was saying, there's nothing to worry about, we have it under control. There was clear evidence that that was not the case. But on March 2nd, when the US recorded its first death, myself and Dr. Mary Bassett, who was the former New York City Health Commissioner, wrote a piece in the Washington Post where we said that the deep, deep-rooted inequities in this country, including along racial lines, but also economic inequities, along with the fact that there was a deep mistrust in institutions, anti-science, alternative facts reality of this administration, and anti-immigrant sentiment was basically a recipe for disaster. So on March 2nd, we said, unless the government takes a very explicit health equity approach, this country could have the worst epidemic among any wealthy nation. And it started proving to be true. And so in March, I joined the Poor People's Campaign as part of their Health Justice Advisory Committee to think explicitly around the poorest Americans, low-income workers, what protections were being given to them, around racial justice issues, decarceration of prisoners who were being left in a state where they were being put at risk. And there was a lot of writing, a lot of policy, a lot of calling attention, communications. And then April hit, and we were looking at how different cities were policing COVID. Instead of providing the means for people to follow stay-at-home orders, there were people being pulled off buses for not wearing masks, especially men of color being sort of getting arrested by the police. And I wrote a piece in Foreign Affairs, again with Mary, around public health responses require a public health approach, which is around prevention and solidarity and making means available. We know that from the HIV pandemic, but it's not around policing. So when President Trump decided to pull out of the WHO, meaning defund, because he later pulled out, and I was seeing so many failures to provide PPE, failures to provide adequate testing, failures to take this seriously, it felt that I couldn't just sit on the sidelines and say, please do better, which was what I was trying to do. And I had to step in. The most direct way to make a difference is to be part of that solution. So that's why I'm in the race.
That's great. And so, in mid-April, you said, I'm getting in. There's big problems. They're not getting it right. They're not using the science. They're not using everything we know about how to do this right. And that's about 2 months ago. So in the past 2 months, are things getting better? And I don't mean are people getting healthier. I mean, is our response at a government level, has that improved, or are we still operating at less than the things we know we ought to be doing?
At the national level, we're not getting better. Governor Baker has his four-phase plan, and he was explicit saying that it's data-driven. I don't think we have enough testing capacity. We do not have enough, do the contract tracing, the things that public health, the technical solutions that the public health community wants and says is essential for us to actually reopen safely. We haven't gotten there. Maybe there is a little bit better, procurement of PPE, but I don't think we've adequately addressed some of the deep inequities, the fact that some low-income workers will go back to work without having access to a mask, or that some individuals who live in overcrowded housing may not be able to protect their elderly parents. Nursing homes, we've learned a lot about nursing homes, and that's where in Massachusetts the highest number of deaths have happened. So I think we've learned a lot there on how to protect our elderly. But I do think there's still a long way to go. And unfortunately, the public, including myself, I have 3 kids. I do not want to be at home. I think the public is ready to get out and get back, but COVID is still around. So I don't think this is going to be over in a month or two. It's not even going to be over in 6 months or a year. This is an 18 months to 2-year process with multiple waves. And we need to have people with my background throughout thinking about, there will be a lot of learning. There will be new questions every time, but we need people who can look at the data, look at the evidence, talk to the scientists who are actually doing the research, and come up with a plan that works for our economy and that works for our health.
And so, I'd love to pick your brain about what you think June through December looks like. But for you, if things go well for you, you're campaigning almost that entire time. focused on that. And so I think what's most relevant is if you are fortunate enough to win the primary on September 1st, the Democratic primary, and then go on to win the general election on November 3rd, you would catch a plane or maybe a train or an automobile to Washington, D.C. in early January, maybe earlier, but certainly by early January, and you'd get to work. And so given your background and your expertise and your motivation for running, whether or not things have settled down in this first wave, maybe the only wave, but maybe not, of COVID, or things have gotten worse as we're seeing in the so-called red states and red counties. What are you going to do? What's on your list of the things that the Congress specifically can do so that 2021 is a heck of a better year than 2020? And how do you set those priorities? What are you gonna really try to put your stamp on, your fingerprints on?
So I hope that 2021 will be better. I do think, given the numbers in terms of unemployment, it's going to be a hard year for many, many Americans. And, I want to talk both as a public health expert, but also as someone who's a social epidemiologist. And let me just clarify the distinction. A social epidemiologist doesn't look at disease as something that's merely the absence of illness. It's about our well-being. It's about our health. It's about our communities. It's about having the economic ability to buy healthy food. So poverty is a key risk factor for poor health. So I'm concerned about COVID, but I'm also concerned about poverty. I'm also concerned about environmental degradation and what is happening. So I just want to make that distinction for a second to say that I'm not going to be only focusing on getting our testing or our contact tracers in place. That is a given. I will make sure that their local and state authorities are doing this, have the resources to do this, and that we're targeting the testing in the communities most impacted. But the conversation has to go much beyond that. It has to go to ensuring that small business owners have resources to stay afloat, that households that have kids, like my household, have a predictable plan for their education. I mean, I am very worried, and I'm sure many parents across District 4 are worried about our children. My 7-year-old, went to first grade, just graduated from first grade, or is graduating from Pierce next week. And I'm worried. I'm worried that she hasn't really learned how to read, and she'll be going to second grade. And what if she doesn't learn how to read until the end of second grade? What does that mean for the long term? So my priorities are going to be around planning and opening up, but ensuring that schools, for example, are not firing teachers at this moment in time. We do have to have a COVID recovery that recognizes that a healthy America is also a more prosperous America in the future. So I would be ensuring that, immediately people have resources, so money in the forms of, some sort of basic income, and then making sure that the schools are opening up safely, but they are, and that we are better positioned to deal with second, third, and fourth wave. It's not a question of if, it's going to happen, but it doesn't have to, we don't have to shut down in the same way that we did just now. If we have the public health measures in place, we can isolate, shut down smaller parts, not do this massive, tremendously painful shutdown that we've all gone through.
You snuck in there. I want to make sure I heard you right. You used the words basic income, and we've heard this during the presidential primaries with Andrew Yang, who talked about a universal basic income. You didn't say universal, though. And so I want to just...
I didn't say universal.
Give you a minute to explain a little bit more. You talked about poverty and how important that is as a predictor for health. And, you mentioned economic downturn and how painful it is for some folks, and then he said basic income. So I want to give you a few minutes to talk a little more about how those things come together and what policy to address those things looks like if you're the author.
Yeah, thanks, Tommy. And the reason I didn't say universal is because at this point in time, I think we need to be targeted. We need to be targeted at those who have recently been unemployed or recently been pushed into poverty, undocumented as well, should have access to, a check. We need to ensure that the poorest among us in District 4, as well as across the country, do not need to worry about whether they can pay for food or for housing. So there are two ways of doing that. One is providing, people got the $1,200, that is not enough. Everybody agrees that that's not enough. So there has to be a continuous form of income for those who are not in a position where they are receiving their income. And I think uninsurance, policy is cumbersome. So I do think that a basic income model that gets rid of some of the administrative costs is the fast way. And I don't know how I would tailor it. It might be by, previous tax returns, but it might also be at the neighborhood level, recognizing that poverty and inequality is patterned. So there would be some communities that would need an infusion of additional financial support. And that is at the individual level, the household level, but also for community groups. I really believe strongly that we need to make sure that communities are able to help each other. We've seen such individual level, mutual aid groups pop up, and support and solidarity between neighbors. Wouldn't it be better for the government to be providing some of these resources and then allowing for that shared communal response too?
And I'm going to get on my soapbox for just a moment and point out that, the mutual aid organizations across the district and across the state are amazing. And I'm going to say something that they know and understand and try to work through that some of us forget. If you are in the majority within your community, whatever that means, you speak the language that everyone in your community speaks, you go to the same churches or synagogues or temples, you participate in the same cultural experiences, you're likely to be relatively well connected, and mutual aid is easier to receive. However, if you are the other, whatever that means in your community, you're not necessarily as well plugged in. That could mean literally you have a flip phone and you are 75 years old and you just don't have a lot of friends. It doesn't have to be about skin color or language. But if you are the other, it's much harder to receive charity and mutual aid. And that is a place where I believe saying, well, just rely on charity isn't good enough. Where, I just, that's me speaking. This is one of the important roles of government, is helping everyone, not just the folks who need help, who are in the majority or in the common culture, whatever neighborhood that is. So I'm glad that you mentioned that. That is important to me. Earlier, you also talked about how COVID isn't striking, we talked about poverty, but you also talked about how COVID isn't striking across racial or other ethnic lines evenly. And can you tell us a little more about that? And maybe, I don't know, tie it to the conversation we've been having, at least in the month of June, about race.
Yeah. So I think it's really important, Tommy, to make a distinction here. We know that COVID is killing Black Americans, Indigenous Americans, Hispanic Americans at rates that are much, much higher than white Americans. And this is particularly true for young Americans. There was a paper that just came out from Harvard, actually, my friends and colleagues put out, that showed that among the 35 to 44-year-olds, Black Americans are dying at 9 times a higher rate than white Americans. So at older ages, we don't see these racial inequities, but among the parents, your school teachers, the productive part of society, we are losing so many more people of color through this horrific COVID response, this failure. So this failure has hit hardest communities of color. And I do believe that we need to be explicit that it's not because of race. Some people are saying, well, these groups have higher pre-existing conditions, but as a social epidemiologist, we also know those are there because of racism. Racism has allowed our country to be patterned by income, by disease. Black moms are dying at 3 times higher rates in terms of maternal mortality. The same is true for infant mortality. So this isn't new for public health experts like myself, who have worked on racial injustice and racism in health. And, I've done a lot of research on that. We know that racism is a key challenge to having health equity. So now bring in the police brutality, the horrific murder of George Floyd, and the protests. I think the two are linked. They're obviously separate, but I think Americans are both more aware of racism as a predictor for health because of COVID, and then seeing this violence on top of it. It is just such a deep injustice and such a failure. And I am so glad that there is this call for change that has been embraced, by so many people. And what has been wonderful running for office during COVID is that I get to have conversations with people who I probably wouldn't be talking to, and sitting in on Democratic town committee meetings with white, older, members of District 4 saying, let's read White Fragility, or let's have a protest. And that has been so wonderful to see that this isn't a fight that only Black Americans are in. Everybody across District 4 who I've spoken to believes that we have failed to have a country that is equitable, and we have failed on the police violence part. But COVID, I think, has allowed us to see this failure as more of a systemic failure. It is not just that the police is a problem. Our country has a problem with systemic racism.
So you've talked about poverty and you've talked about public health, but even if we get those right, that chips away at some of the inequities that people of color face. And even if we get policing right, which was always going to be a moving target and never going to be perfect, let's be clear. But if we make substantial improvements there, is that it? Or is there more to supporting our neighbors and our friends and our colleagues who are Black or Hispanic? And what else is there that we at the federal level, which is of course the job that you're applying for, ought to be doing to destroy the structural racism and, if you think so, help people of color be brought up to parity in terms of wealth and opportunity?
Well, I do think that we have to have the conversation on reparations. I think that has been sort of on the margins, and there's been, a call from it, but I do think that now is the moment, and it may be time to move that conversation beyond just setting up, a committee to study it, to really think about what reparations, what does it mean to acknowledge the 400 years of slavery, Jim Crow, everything that we have done. Other countries have battled with their legacy, have apologized to Indigenous groups. I think there is a real opportunity right now for the federal government to take real leadership, to acknowledge the systemic ways in which, why we are here. Housing segregation, redlining. They were federally, decisions that were taken at the federal level. These are not individuals who fail to pull themselves up by their bootstraps. This has been an unfair country for so many Americans. So I do think we have to have the conversation about reparations, but that's not, the only way. I do think there are immediate things we can do around education quality and equity there, around housing, the fact that we don't have enough affordable housing in Brookline, for example, or we do need to have these conversations around how we have allowed ourselves to not come to terms with those things. So I think police is going to be the first at the forefront, how we deal with police violence, but I hope it doesn't end there. I think the health community has been talking about how even within the healthcare sector, a mom that comes in with the same problem, or a child that comes in with the same problem, if they're Black, they get some type of medication. If they're white, they get another form of medication. I mean, some of the most horrific research I've looked at is with appendicitis. White kids get opioids and Black kids don't, because there's this kind of misconception that pain and, giving Black children may get them addicted. So they allow Black children to feel more pain. I mean, there is a lot that we need to move forward in this conversation, and I want to be part of that solution. I think the first step is explicitly acknowledging the racist history.
Natalia, thank you so much for coming on the program. Thank you, Brookline Interactive Group, for hosting us. We've got about a minute left, and I want to give you that minute to fill in the gap. Anything that I missed, anything that you want to get out there, we're listening. So tell us what you want us to hear.
Tommy, I'm running on a platform to bring science and equity to Congress. I think we need it. We need it today more than ever, but we will need it for future pandemics. We will need it to address the climate challenge, the climate emergency. So if you really believe that scientists have been sidelined and that they need to be part of elected politics, I hope you will vote for me. And if you believe that my progressive values are the ones that you share, do have a look at my website at nataliaforcongress.com. That's Natalia for Congress.
Natalia, thank you so much for spending some time with me. I know you're so busy, and I'm delighted that I got to ask you some questions and hear what you're all about. I wish you the best of luck. The primary is September 1st. Natalia Linos is running for Congress in the 4th Congressional District. If you are interested in voting in the Democratic primary because you're a Democrat or unenrolled, I encourage you to get out and vote. If you're interested in voting in the Republican primary, there's also 2 Republican candidates, so you should also get out and vote. It'll be Tuesday, September 1st. There will almost certainly be voting by mail. You will be able to vote in person. It's so important. Thank you, Natalia, again, for joining me. Thank you for tuning in. I'm Tommy Vitolo, and it was great to spend some time with you today.
Thank you so much, Tommy.